Medical professionals of Reddit, what's the worst piece of advice your patients have gotten from Dr. Google? A 2-week-old infant was admitted to my hospital with severe jaundice, which at birth is normal. The mother, though, hadn't been breastfeeding the child because she read on the internet that breastfeeding is bad for babies. She decided the next best thing to do would be to feed the child a mixture of cornstarch and water because formula was too expensive. The baby lived, magically. People, though, man. I guess my question is how far down the rabbit hole you need to go before you find places saying breastfeeding is bad for babies. I've posted this before, but I had a patient with aggressive prostate cancer come in and tell me he hadn't been following up because he was drinking grape juice with baking soda, and that it was slowing the cancer growth. I told him in fact it was not, and the cancer was spreading. He said he disagreed, and would continue with the juice. Natural selection can be really aggressive sometimes. Herbal supplements cure Parkinson's. All that Mercury horseshit. Guy lived as a human statue for 10 years, communicating only by blinking. I came in, took one look, and dragged his butt to a neurologist. 1 month on the appropriate meds, he started walking, talking, and living semi-independently. It still pisses me off mightily. His mother, who was his sidekick and biggest supporter and instigator of this lunacy, felt he was betraying his spirit soul in thoughtfulness. She died of cancer after trying to treat it with herbs. Freaking prize. I had a patient rub garlic and onions into an infected abscess and soaked it in undiluted bleach several times a day. He couldn't understand why it was getting worse and where his chemical burn came from. What the frick? My good friend in college once showed up randomly at my dorm in the middle of the night, freaking out because she thought she was having a miscarriage. This was a surprise to me because I knew she'd been on her period recently, so I asked her when she found out she was pregnant. She gave me a blank stare and then said, "You have to be pregnant to have a miscarriage?" I guess she just googled her symptoms, bleeding and abdominal pain, and settled on the first result without reading anything about it. The kicker was that she was really smart otherwise. I have no idea how she'd never heard of a miscarriage before. It says here that you might have network connectivity problems. I'm a pharmacist, and I used to work in a large retail pharmacy. An older couple came in to pick up a prescription for tamoxifen, which blocks the ability of estrogen to stimulate breast cancer cell growth. As I'm ringing them up, they ask which aisle can they find vitamin C in. I ask them some further questions which reveals that they read online that vitamin C could treat and prevent cancer, and they wanted an additional remedy so that the wife would not have to take her medication and would never get breast cancer again. It was kind of sad, actually. Same profession except in the hospital. It's amazing how many people honestly consider homeopathic medicine as an alternative. Had a friend of mine whose mom came down with cancer. They refused chemo citing it was toxic and that home remedies work better than these. It made me sad hearing about that. An effective method of birth control is abstaining when the woman is on her period, because you can only get pregnant when the egg is being released. The second part is true, but the egg is released and available to fertilize during ovulation, which is in the middle of the cycle, not during menses. You should abstain during ovulation to avoid pregnancy. Cinnamon to treat diabetes. Patient came in telling my attending that she was pretty sure it worked because she checked her blood glucose and it was high. She took the 1000 mg of cinnamon pill, and a little later her glucose went down. Now, if you check your blood glucose, the next step is to correct with insulin. So we asked if she just took the cinnamon by itself or with the insulin. She says with the insulin. Then don't you think maybe, just maybe, it was the insulin that lowered your glucose levels? But nope. Cinnamon must have done the trick. It's all natural with good ingredients. Actually, cinnamon has been clinically proven to have an effect on blood sugar by lowering blood glucose levels. The study even says it could be helpful in the treatment of diabetes in addition to usual care. Basically, the cinnamon helps, but not tremendously. The studies were posted in Journal of the American Board of Family Medicine. Almost as bad as Dr. Google is Dr. Military Doctor. Here's an ibuprofen for that broken leg. Oh, you have kidney stones. Here's an extra strength ibuprofen. In 6th grade, I shattered both my kneecaps. The military hospital, though, kept telling me I had ACL tears because they didn't bother to actually look at the x-rays they took until I had my 6-week checkup. Didn't even spring for a wheelchair. I had to row myself around the house with a computer chair and a broom handle. On behalf of my sister, when I had my ileostomy bag, like a colostomy but for your small intestine, and by had, it was reversed in 2012 and my intestines are complete now, -3 feet, there was a blockage. A blockage is extremely painful as nothing can get out and you bloat very fast. You also vomit. You feel unbelievable stomach pains. It's like a trapped fart. The stoma is a tiny hole. I had a blockage and I was really upset and wanted to go to the ER. My older sister is a nurse and had been visiting us at the time. My mom said the internet says to stick your finger in the stoma and just pull it out. We stared at her, horrified. No one was putting any freaking fingers into a hole in my abdomen, into my intestines. My sister took me to the hospital herself. They gave me some drugs and I went under. They removed it. Turns out no one told me I couldn't have vegetables and fruits. I had carrots and strawberries the night before. They didn't go over very well. My mom is kind of a badass for wanting to do that for me. But holy crap, no mom. I clogged my garbage disposal with carrot peels the other day, so dang. I could write an essay on this. Any herbal supplement bullocks. For an example, when you first get out of school you have to put many hours in, specifically at health clinics. You have no idea how dumb people are. One guy said he saw online that taking a knife to his goiter and draining it and cleaning it would be a good idea. Drinking sugar water with salt to make Gatorade would help with electrolytes that would help his high blood pressure. I can go on. Suppose the worst was a man with dementia and was told that he had to spend $5,000 for a prayer to cure him. They did it twice to him because he forgot he gave the first time. Suppose the worst was a man with dementia and was told that he had to spend $5,000 for a prayer to cure him. They did it twice to him because he forgot he gave the first time. That's an impressive level of evil. Not a doctor, but a vet assistant. Please do not give your dog an enema at home, especially not by using a turkey baster. It will end badly for your dog. Probably not great for the turkey baster, either. A couple had just had a baby, discussing contraception in postnatal period. They said they had been using the pill. They said they had been very compliant and they couldn't figure out how they'd gotten pregnant the first time. Guy pipes up and says, yeah, I take it one day and she takes it the next day. Total cluelessness. I suppose in their defense there's a certain logic to it. There's no logic to guessing how to take a prescription medicine. Read the label. It isn't hard. My boyfriend and I joke that his mother has an MD from the Dr. Oz School of Medicine, with a specialty in web and Yahoo answer searching. You think of a quack treatment, she'll tell you how it can cure my boyfriend's Lyme disease. She's all about detoxifying, raspberry ketones, lemon juice for curing cancer, high dose vitamin D, colloidal silver, salt caves, vitamin infusion therapy, Himalayan salt lamps, essential oils, burning sage to ward off evil spirits, Epsom salts. Her latest craze is hyperbaric oxygen therapy to cleanse toxins and heal brain damage. Never mind that HBOT is not FDA approved for brain conditions, and has not been shown to be effective for TB or brain damage, or that toxins are the ill humors of today's medically uneducated masses. They told my boyfriend that the HBOT makes his skin absorb oxygen, which is important because the skin is the largest organ, and oxygen is our most vital element because we're over 60% oxygen by weight. Pretty sure if cleansing the body with oxygen absorbed through the skin was a thing, we would have evolved without lungs or kidneys and livers. But what do I know? I'm only an engineer, not a doctor. In any case, my boyfriend has been feeling worse since starting HBOT. Wait till she finds out that antioxidants are working against oxygen. I work at a veterinary clinic and this woman said that she read online that if she fed her dog only raw carrots for a few days that it would scrape any parasites out of the dog's intestines. She brought in a fecal sample for testing and it was 90% carrot. Poor dog. My dog ate 16 radishes out of the neighbor's garden and had white poo for a few days this spring. Not a medic, but I once met a man who swore he cured his own prostate cancer by drinking 4 liters of water a day laced with X drops of hydrogen peroxide. Here's the science. Oxygen helps repair cells. Water has oxygen because it's H2O. Hydrogen peroxide is H2O2, therefore twice the oxygen equals twice the cell repair. I'll have some H2O, too. Not a dentist myself, but I work the lab at an office and occasionally assist when I have free time. To the anti-fluoride people who come in every now and then can cause some pretty big headaches. Their teeth will be in crap shape, but they'll refuse even the simplest of treatments. You know, like brushing their teeth with a better toothpaste, because they're scared we're trying to poison them. There was one lady who went on a tirade about only allowing natural products in her body and strictly no chemicals, and how fluoride is scientifically proven to be toxic. I mean, it is toxic, but dose isn't all that. Even water can be freaking toxic. But then after trying to explain and reason with her, she brought up her IQ and told the dentist she was smarter. She got the red pen on her chart. Not a professional but a volunteer who happened to get a lot of patient contact. Here are some of my faves. Man who tore up his leg jumping a fence and decided to stitch it up with a sewing kit and rub it daily with lavender and honey. The honey attracted bugs while he slept. Girl who tried to cure a yeast infection with tampons soaked in yogurt and fruit juice. Not even cranberry. She insisted on lecturing me about the health benefits of shoving orange juice in an infected cooch. Woman with atherosclerosis who'd been eating multiple bars of dark chocolate a day because it was good for the heart. People are insane. Clinical psychologist in US. We get tons of people self-diagnosing adult ADHD, particularly around college finals. Aside from secondary gain, stimulants can help with focus whether you have ADHD or not. Many people do not realize that anxiety and depression can seriously impact your ability to focus, but do not want to accept these diagnoses because ADHD has less stigma. Not to say you can't have both ADHD and anxiety depression, but typically you want to treat the mood issues first to see if this resolves the attentional difficulties. And the other side of this, people who took an online test and think they have bipolar disorder. The average specialty requires anywhere from 120,000 to 0,000 hours of training prior to being able to practice, and that's not counting subspecialization within a given specialty. The average idiot requires a superficial search without access to or understanding of medical research and a very small, very dangerous amount of information to believe they're better informed than their doctor. I'm all for patients being informed and making sound, rational decisions, but usually a small amount of information can result in an obstructive patient or family who prevents themselves or their loved one from receiving the best possible care. There are many good resources online to get yourself informed, but realize the docs are generally just trying to do their best. Example is the child of a patient who's a pre-med student. Read about a disease on Wikipedia, and now thinks she knows the technical aspects of a Whipple in addition to post-op management. Ask us what we're doing and why. I'm all for it. But don't halt us at every dang step when we're just trying to make sure your parent has enough fluid in his vascular tree to pee normally. Also, buttholes who don't vaccinate their children. Source: Chief Surgical Resident at a large community hospital in a major city. Had a patient who changed from drinking 12 Dr. Peppers per day to 4 liters of apple juice per day to get better control of his diabetes. He did not get better control of his diabetes. Parents not getting their kids vaccinated. I just can't get my head around it at all. One of my colleagues, who is a pediatrician, finally said enough is enough, and any parents that wouldn't vaccinate their child would be discharged from the practice and would be given other physicians' information because this particular physician would tell the As a dentist, 1. You can fix cavities with coconut oil, thanks to Pinterest. 2. Fluoride gives you brain cancer. 3. No X-rays for me please. I'm strictly no radiation, though they have a suntan. Just let them know it's a gluten-free X-ray machine. I had a 20-year-old girl come to the ER because she thought she was having a stroke. She smelled smoke and looked it up online somewhere and decided it must be a stroke. I asked her a bit more about it and she actually saw smoke too. That is, she was near a fire. My cousin broke his arm and instead of going to the doctor, my grandma just put mud on it and said that'll put it back together. If you're ever an adult, do this because the doctors will inject stuff and give you bad medicine. Mexican and somewhat old, but come on. Yesterday someone was convinced they got their strep wound infection from the air. I didn't ask where that logic came from, but I bet it had something to do with the internet. An old guy I met had earwax blocking his ear canal. Someone told him hydrogen peroxide would fix it. He used an eyedropper to put 10% H2O2 solution in his ear. He subsequently went deaf in that ear. Not a medical professional, but my dad has been ill for 15 years and my family and I have been his primary caregivers for the entirety. So we go to all of his doctor appointments. We've been through all of the stages of hoping something will slow down or reverse some effects of the illness. We've tried just about anything you can do yourself, any lifestyle change you can make to be healthier, any at-home techniques to make things better. We've tried it all. We grew up eating all organic, tried being vegetarian, all herbal supplements, using all natural cleaning supplies. We had an all-natural wood sauna built in our garage. Anything hippie you could think of, dad was kind of a hippie anyways. The funniest thing I hear people claim they need to do waste money on is to go to a sauna strictly for the purpose of sweating out toxins. I never say anything, and I laugh internally. That's not how it works. Your body gets rid of toxins automatically every day and the process isn't expedited by sweating profusely. Sweating can be very good for your skin. You can sweat out dirt, makeup, oils, bacteria that have been sitting in your pores, but it's not flushing out toxins from inside your body. If no one could automatically get rid of toxins without having to sweat profusely, everyone would be dead. You probably can't sweat out the toxins, but I'll be damned if it doesn't feel like it when you're in one with a giant hangover. Not me, but my SO is a PA and she told me of a diabetic patient had come in because his blood sugar was 400 or 500, unknown unit of measurement, and he said he stopped taking insulin because he saw online he could take cinnamon instead. I'm a diabetes educator in training and oddly enough have seen this happen more than once. Many people think insulin is a sign of failure or the devil. I have to constantly remind people that insulin is not a bad thing. In fact, will make you better. Sigh. Not a medical professional, just have relatives who try to push Dr. Google treatments onto me. I've been told that honey, salt and baking soda for 3 weeks cures epileptic seizures. Also, from the same person, that I need to cleanse toxins by eating nothing but cabbage and drink aloe vera. Those can also help cure seizures and I shouldn't take my prescribed ED medications because they are poison. My mother is wearing out her welcome on earth. A friend of mine tried curing a UTI with acupuncture. It didn't work and she ended up going to a doctor and absolutely flipping out about having to take an antibiotic. Like, she had trouble sleeping, she was so afraid of it being toxic. Not a medical professional, but goddamn the crap women tell other women to do to avoid going to the doctor for easily treatable problems like yeast infections and UTIs are horrendous. Putting yogurt soaked tampon up your vag is my favorite one. You're supposed to eat the yogurt, not give it to the fungus to eat and grow more. My other favorite is douching with apple cider vinegar. This is what imbalances the pH of your vagina, allowing the yeast to flourish rather than die. Take some freaking meds, people. 3-month-old baby was not eating as much as she normally does. Crap was a funny color. Has been spitting up a lot. She breathes really fast. Her heart rate is very fast. Mother somehow got some kind of organ failure. Took her to the local urgent care ED combo that we have. Gave baby fluids for possible dehydration. Did all kinds of tests. Everything negative. Baby was eating fine at ED. Didn't spit up. Poop was poop. Vitals were within normal limits. Argued with us saying that it was too fast. Her reasoning was she googled normal pulse and resps for adults, thinking they were supposed to be the same as babies. Got discharged, we took her home. Back in the morning for the same crap. Wants to be taken to our main hospital an hour away because it has a PEDS floor. Same crap, gets discharged, taken back home. Calls 911 an hour after being taken home. For the same freaking problem. Okay, well, where do you want to go? Children's Hospital of Filler. No, that is too far. We can either take you to Virtua or Cooper. I want to go to Chop. Mom, Chop is an hour away. We can't bypass 2 hospitals to take you out of state. Refusal. Goes to the urgent care ED. Gets admitted. Demands for Chop to come and pick up her child from that ED. Decided to not get involved and just stay in my little closet. She disappeared. Wherever she went must have not worked because she was in the ED again 3 days later for the same crap again. TLDR. Had a woman call 2 hospitals and all their staff the most incompetent people on the planet because who on the world would lie on the internet? Physiotherapist here. We get plenty of patients coming in after the stuff they tried themselves has ended up making them worse. I'll frequently get patients in complaining of back pain who have been doing sit-ups to try and relieve it. Most of these people have discogenic pain posterior derangements and make themselves a whole lot worse with sit-ups. I'll also get patients who I've given a specific exercise program to go home, Google more, and do those as well. For instance, had a post-op ACL patient go home and start doing plyometric exercises because he'd seen on Google that that was what you were supposed to do, despite the fact that I'd spent the last hour talking him through rehab progression, healing times etc, and had been very clear that he wouldn't be able to do that kind of stuff for at least another few months. He ruptured the graft. We'll get plenty of people who swear by absurd diets or homeopathic remedies and are sure these things are doing more for their injuries than myself or their doctor are. Some of the more frustrating patients are the ones who've self-diagnosed and then come in demanding a specific treatment. Most of the time, their diagnosis is wrong, as they've just read a couple of symptoms, usually along the lines of pain around this area and occurs most frequently within insert very broad population group, and they'll refuse to accept that it might be something else. They are also the most likely to demand alternative, inappropriate, as in, not appropriate for their injury, or just useless treatments. Plenty of people coming and demanding manipulations when not appropriate, demanding therapeutic ultrasound when it's a load of crap, or demanding incredibly obscure or weird treatments. I have it the other way round. Dr. Google says this particular pill possibly has permanent side effects. Doc laughs it off, tells me to keep going. Now I suffer from those side effects. I had a patient require emergent liver transplant because of liver failure caused by herbal supplements. I'm guessing the internet told her that herbal supplements were natural and therefore safe and better for her. So scary. I think I mentioned it before, but I used to belong to a web forum for spinal cord injuries, and once upon a time there was a post there all about how we could heal ourselves if we just ate more fish, because fish will drive the toxins out of our bodies. Yeah, my spine isn't freaking broken, it's those dang toxins. But mercury. PT had a bad ulcer on her eye, and decided to treat it by using breast milk. She was using breast milk eye drops on her dang eye. We saw her too late, and she went blind in that eye. Not Dr. Google, but as a med student on my GI rotation we saw a patient whose boyfriend convinced her that her Hep C medications were more dangerous than actually having Hep C. So she flushed them. 6 months of pills to the tune of over 70k. She was back because she realized she needed them and wanted a new prescription. Yeah, good luck with that. My mother was doing a rotation at a rural health clinic in Texas during school. Whenever she would see sexually active women, she would verify they were practicing safe sex. One woman confirmed she was very diligent about using a jelly. My mother asked what kind, and she replied with Smucker's grape. Pregnancy and a yeast infection. Here is a reverse of this. I had a doctor years ago decide that a panic attack was being caused by a bad diet after she sat there googling the ingredients of my dinner the night before. Not a medical professional, but I have met someone who read on the internet that a mixture of various blended household plastics, like water bottles or trays, would help you have more stamina when exercising. I really hope they didn't try it, and have no idea why they believed it or what connection they made with plastics to stamina, or anything for that matter, but I guess I'll never know. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.